So I think every adult over the age of 18 should have a yearly physical exam, so basically a wellness exam once per year. At this visit, it gives you time kind of one-on-one with your doctor to kind of go over your past medical history, talk about screening labs and imaging that might be required, so that way we can take good care of your health and keep you healthy. When you see your physician, you need to talk to them about different things in terms of vaccinations and what screenings are recommended. For women, I advise you to talk with your physician about when you need your pap smear and how often you need your pap smear, as well as mammograms, as well as colonoscopy screenings as well. For men, I would advise you to talk to your physician about colonoscopies and also the prostate screening test. And of course, if you need a prostate screening test, and how often and when you should get that done. And a lot of times that kind of goes on a case-by-case basis. The vaccines you should talk to your physician about are the tetanus booster vaccine, the Tdap. You also need to talk to them about the pneumonia vaccine, Pneumovax, or the Prevnar 13. And also ask them about the flu shot and also the shingles vaccination too. So 18 to 40, generally basically for women, you need to get a pap smear every 3 years or a pap test plus the HPV test every 5 years. I know I have a lot of patients coming to me expecting kind of the pap smear every year, which we can do, but now the guidelines have changed as medicine is kind of changing as well. So every 3 to 5 years is appropriate for a pap or pap with HPV test. A lot of times women, when they start having mammograms at 40, the guidelines say starting at 50 is appropriate now, at least every 2 years. But of course, everything's on a case-by-case basis depending on your family history and any risk factors. So I'd advise you talking with your physician about when and how often you need your pap smear and mammogram screening, as well as your colonoscopy. So 40 to 50, again, for women, it's at least pap smear every 3 to 5 years. Some women still want it yearly, which is fine. Also, depending on family history, you might need colonoscopies or mammograms at an earlier time, but 40 to 49 is when you should have your discussion with your physician about the mammogram screening. So 50 to 65, this is when I'm really kind of big about the colonoscopy screening. So colonoscopy screenings are done by our gastroenterologist or our GI specialist. It's basically the gold standard to detect any kind of colon cancer. A lot of times with that procedure, when we basically do the colonoscopy, they can look for any abnormalities that they may see. And sometimes if something is detected where they see a polyp or something that they're concerned about, at that time they can, take a piece of it, remove it, and send to pathology to see what's going on. So it's diagnostic and therapeutic. For people that don't want to do colonoscopies, there's also stool card kits that you can take home called the FOBT kit that can detect any blood that you can't see with the naked eye, or something that you may have seen commercials about called the Cologuard. That's also another at-home screening test that you can use as well. 65 plus. So 65 plus, you make sure you talk to your physicians about the shingles vaccine, the pneumonia vaccine, and of course, usually for women and some men with risk factors, gain at least a bone density scan every couple of years too. I know it can be scary going to a physician's office for the first time, but rest assured that all good physicians out there want the best for you, and your health is of their utmost concern. So when you go to the doctor's office, it's of course, really important to let them know, hey, I've been having these concerns. This is what's been going on. What do you think about this? And every doctor that you see will try and, build that patient relationship with you to kind of work well for you and kind of figure out what the best options are for you. So whether you need lab work or referrals or certain imaging studies done, your doctors will give you options and try to work with you to figure out what the best option is for you, and also to treat you well and make sure that all of your health needs are addressed. So I know it can be scary at first, but I think, talking with friends and family that you live with or friends in the area about who they like to see and kind of what their experiences have been with doctors in the past and who they recommend is also a good first start. And I also want you to know that doctors aren't here to judge you, we're here to help you. So any and all questions that you have, don't think any question is a silly question or a crazy question or any kind of crazy thoughts, because we've heard it all and we're here to help you.